Does spinal anesthesia really cause long-term back pain? But the pain is real. Why would you trust me if I tell you I have less or no back pain after C-section compared to before? Wait, what? Hello everyone, welcome back to our channel. If you're new here, I'm Dr. Swati. I'm a qualified anesthesiologist. Does spinal anesthesia really cause long-term back pain? How to avoid back pain and heal back pain? What helped me to do this? All answers in this one week. Please watch the video till the end for 5 fail-proof steps that has helped me overcome back pain. Let's get started. First things first, what is spinal anesthesia? It just means that a local anesthetic medicine is injected into a space around the spinal cord that contains cerebrospinal fluid. So when the CSF, the cerebrospinal fluid containing this anesthetic drug, bathes the spinal cord, it blocks the signals that pass through these nerves, causing numbness to touch, temperature and pain, and relaxing the muscles of the lower body. This makes surgeries of the lower bodies possible without putting you to sleep. Now let's systematically analyze the belief that spinal anesthesia for a cesarean section causes long-term back pain. There is no evidence whatsoever that associates spinal anesthesia and long-term back pain. So I can go out on a limb and say that this is a myth. But the pain is real. C-section mommies do get back pain post-delivery. I know it firsthand. Why does it happen and what are the reasons for it? This could be a back pain that you had before delivery during your pregnancy, which is a very common thing. And for a few hours, you don't have any pain in the lower body because of the spinal anesthesia. And as you recover from the effect of the spinal, the back pain may become more evident to you. During your pregnancy, a hormone called relaxin makes your joints and ligaments loose. This happens in order to house your growing uterus and to deliver your baby. But this will also cause joint instability, causes strain on the back. And the curvature of your back changes because of the growing uterus. The abdominal muscles become thin during pregnancy and is also breached during C-section. This will cause extra stress on the back muscle. And this is especially more troublesome if you've had back pain before your pregnancy. There is an entity called postspinal back pain. But this does not happen in all cases. It is more common when big spinal needles are used. It also depends on the position for surgery because I told you your muscles get fully relaxed after spinal. This makes overstretching also a possibility. So if the position we put you in for surgery causes too much stretching, like in lithotomy, then this might be a reason for pain. The number of attempts that we take to give you a spinal and the duration of the surgery. In case of a C-section, let me assure you, we use very thin spinal needle and you lie down flat for a C-section. No untoward stretching. The number of attempts are kept as minimal as possible and C-section usually is a very quick operation. So even in case that you have postspinal back pain, this entity is by definition a mild discomfort and shouldn't last more than a few days at the most. So long-term back pain, definitely not postspinal back pain. What are the other causes? There is a wound, a big wound in the uterus, and the healing of the uterus may feel as a back discomfort for you. Your posture after cesarean delivery takes a toll. Again, back pain. And all this back pain after C-section, spinal or general anesthesia are all short lasting. If you can tackle each of these causes, you will definitely be able to overcome back pain post C-section. I've had so many patients refusing to take spinal anesthesia and want to undergo general anesthesia for this one belief. But this is what I tell my patients now that I've experienced it firsthand. With even more conviction, I tell this that it does not cause long-term back pain. And it has so many advantages over general anesthesia in a C-section. There is prompt and fast recovery from anesthesia. There is less post-operative nausea and vomiting. There is less chances of blood clot post-surgery, and it is a much safer option in pregnant women. Also, back pain post-spinal anesthesia when compared to back pain post-general anesthesia is found to be similar in number. But then, I'm an anesthesiologist who makes a living out of giving spinal anesthesia. Why would you trust me if I tell you that this will not cause long-term back pain? So let me just tell you my own experience. I'm Dr. Swati, a mom to 1-year-old. I've had back pain for as long as I remember. I've taken multiple consultations with specialists, bought many painkillers, underwent many sessions of physiotherapy, tried all strengthening exercises in the past. I had to undergo an emergency C-section, cesarean section, and I have less or no back pain after C-section compared to before. Wait, what? I'm not lying. And these are the 5 things I did not only to avoid but to heal my chronic back pain. And before I do that, before I tell you that, please subscribe to our channel if you haven't already and share this with one who needs to hear this. A C-section mom, a mom-to-be, even a mom who has back pain after normal delivery, which is also very common. That will mean a lot to her and to us. Coming back, the 5 must-dos. From 5 to 1 in this order. Number 1 being the game-changer solution that nobody has told you about. 5. Nutrition. I can't stress this enough, especially in our country where most practices tend to restrict food and water to the new mom. Your body doesn't stop requiring good nutrition the moment you deliver. In fact, you need to take even better care than during your pregnancy. You are essentially making one entire person's meal in your body through breast milk. You've lost blood during delivery, even more during the C-section. You have a big wound in the uterus that should heal. And if you have undergone a C-section, it is a major abdominal surgery and you should heal from that. All these require energy and you need nutritious food to give you that energy. You need 500 kilocalories more than your regular intake and this should be wholesome. Make every calorie count, continue your prenatal supplements with your doctor's approval, especially your vitamin D and calcium. Focus on including anti-inflammatory food in your diet like turmeric, whole seeds, vegetables and fruits. Number 4, posture. Posture is what takes a heavy blow after your C-section compared to a normal delivery. The muscles of your abdomen have become thin during your pregnancy and then it is pulled apart during C-section. The tone of your core muscles, the muscles of your abdomen is lost and this will have to be compensated by your back muscles. This extra stress on the back is one of the main reasons to trigger a back pain. Everything you do, sit, stand, your back muscles are doing extra duty to make up for the abdomen's work. So take care of your posture. Make a conscious effort to reduce the stress on back. It is very hard initially with all the chaos of being a new mommy, but this will pay you back. Get adequate rest, avoid sudden movements when you're lifting or holding your baby. Bend from your hips rather than curving your back. Keep your back straight or rested while you breastfeed. Amidst the worry of feeding frequently, getting the baby to latch, we usually tend to forget how we sit when we feed. So remember to always sit with back support. Use a C-pillow or a pillow to elevate the baby. Remember, you should always bring the baby to the breast, never other way around. No slouching, no bending forward, your back will thank you for this. Use an abdominal binder. It acts as a support to your abdomen and back. It distributes the weight of your abdomen more evenly and reduces the strain on your back. It also reminds you to maintain a good posture. And no binders or tying does not decrease your belly fat. It would be wonderful if universe worked that way. Number 3, address it. Address the back pain in the initial stages. A lot of times, the acute pain, the pain that has only just started, can be treated with simple measures. But it is medically difficult to treat after it becomes chronic, meaning a long-term pain. And this holds true for pain anywhere in your body. So address this pain in the beginning itself. Simple measures, as I told you, can be rest and sleep. Very important for your body to heal. Sleep whenever possible. It promotes tissue repair, reduces muscle tension, and a good posture even when you sleep. Hot compresses, hot bath, this will relax the muscle tension and improves blood circulation and helps recovery. Pain medication that is being prescribed for your C-section pain will also help with your back pain. So remember to take them as prescribed by your doctor. And physical therapy. Consult a physical therapist who specializes in postpartum care. A physical therapist can better assess your situation and advise you regarding what will help you in your situation. Exercise. This is another place where C-section mommies are at a disadvantage. The mobility after delivery is restricted because you're not allowed to exercise soon after C-section. But exercise, even gentle exercise, can go a long way to help relieve the painful spasm of back, promote healing, and strengthen your core muscles. Initially, you can just walk a little whenever you can, gentle stretches on the sides now and then to help ease the tightness of the back, pelvic floor exercise to strengthen the pelvic floor, which will indirectly help your back also. On the 6th week visit with your obstetrician, you will get an okay and advice from your obstetrician about exercises that you can start, like glute bridges, side plank. But even now, you cannot engage in strenuous exercises of the abdomen. Remember to work your way up slowly and never do anything that causes you discomfort. Coming to the number 1 solution to your back pain, which was a game changer for me, it was to believe that spinal anesthesia alone will not cause long-term back pain. See, I told you I had back pain from quite a long time. I did everything to address it, or so I thought. But I lacked faith that I could heal back pain. And when it came to back pain post C-section, I believe profoundly because of my profession, because I have promised hundreds of women that spinal anesthesia will not cause pain. So all the steps that I told you, I followed with very strong conviction. And tell you why it is a game changer. I see women in their 40s and 50s coming to us with complaints of back pain and telling us that the cause for their back pain is one spinal they received 20 to 30 years back. What happens when we attribute one single cause for all the pain is we do not do anything about it. No exercise, no treatment, no postural correction. Whenever you get pain, it is because of spinal. I can't do anything about it. So you are, without even meaning to, eliminating all chances of recovering from that pain. And there is a lot of emotional component to pain. If you attach this one single cause to all kinds of back pain, a cause that you can't do anything about, you will only make yourself sad, feel more pain, and the vicious cycle will continue. So trust me, trust the scientific literature. Spinal anesthesia will not cause you long-term back pain. You can heal your back pain. But my job as a doctor does not end till I warn you of the red flags that you should be aware of. A sudden back pain, very excruciating with any degree of weakness in your lower limb, is something you will need immediate medical attention for. Be aware of these things and consult your doctor.